Okay, we are recording. We are back. Hey, everybody.
Yeah.
Technology glitches 2 weeks in a row. What is going on? So,
Well, it's the new moon. Last night was a new moon. Does
yeah,
that have something to do with something?
I don't know. So, well, it still shows we're live, so we'll see.
Okay.
Now, hey, everybody out there. I'm looking at my phone. I should be looking here. We are back. This is Wendy again. We are doing our Self-Care Saturday chat with Nancy Johnson. She is a QNRT therapist. QNRT stands for Quantum Neuro Reset Therapy. And Nancy had been introducing herself and how she came to QNRT therapy. She's got a vast medical background, 35 plus years as a nurse. Experience, a lot of that was in the psych wards with psych patients. And then she herself had, unfortunately, a trauma, was ambushed by some patients, it sounds like. And so that sent her, and that's kind of where she froze and we lost our technology connection. So we are back. Let's pick up there. Just start at the point where you had said that, so I know Nancy had introduced and said that she had worked with patients a lot and wasn't finding, or maybe you just pick up with that, like how you just real short,
Yeah.
that part about like you were finding that traditional methods weren't reaching
Yes.
people, and then you had your
Yes.
own go
Yes.
there. Start.
Yes. Yes. Okay. In being a nurse for years, I discovered after a time that that we weren't traditional kind of the medicine wasn't really helping patients, especially in the mental health world or the psychiatric world. Most of that kind of treatment was either talk therapy, and of course pharmaceuticals. Very limited. Sometimes people would improve, but what I saw over time was these patients kept returning with the same issues. The medications would stop working. It's like, I'm back again. I still can't get rid of all these feelings that I have, blah blah blah. So it just sort of led me down another avenue, sort of a mission of like, what can we do for people that are in the system? And then I think I brought up issues like, I kind of went off and started to think about diet and supplements, and then I got into essential oils. I mean, those are all sort of good adjuncts that I thought helped people. I used them with patients, although I was kind of like told not to, but I still did anyhow. And so because all they could think of was really drugs. And I just, after a while, it felt sort of immoral to me, is that we're just drugging these people up. What are we addressing? Any root issue here? No. So so what happened, ironically, then, is that I working in the field is, it's a tough, stressful area. There's a lot of behavioral issues, a lot of anger, a lot of outbursts. So I was ambushed. Two patients that I was opening this door to let somebody out, and they ambushed me, and that they pushed me into the wall, and it became sort of a nightmare. But the result was I was very traumatized myself. And I was quite shocked as why I was so traumatized. I mean, I've worked in this field for a long, long time. It's like, so I'm just going to tell you, nobody's immune to trauma, because for me, being ambushed is like, it just brings up emotion, fears, whatever it was. And those things are that overrides any cognitive ability to think clearly. So, and that's the problem with trauma, is that the action and your emotions are on two different pages. You have to continue to go, but you can't talk about and say what is going on. So
Yeah.
So it led me to, because I knew I had to really, really deal with this, because I thought, I'm not going to hang on to this. This is not mine, so to speak. I mean, I didn't do anything. And I knew that in my heart of hearts, of the patients, they just wanted out. And I don't think it was a personal attack on me. So I went to this woman I knew who did EMDR therapy, which is another good technique for trauma. And that uses the eye movement back and forth to sort of connect the hemispheres and then reprocess the trauma. And she then told me about this woman who was sort of new, doing this new therapy. And she said, it's so interesting that you should go see her. And so I called this woman, and I did. I started doing QNRT with this woman. She was a fairly new she had been, she was a therapist, but then she also just got certified in this. So I found it to be quite helpful because I was just actually surprised at what she could get at, because sometimes our traumas are layered upon another trauma and another trauma and another
Right.
trauma. So it's sort of this peeling of an onion.
Right.
So it was very intriguing and very helpful and able to get to things that I would never have thought of. So that led me to think, well, maybe I should get trained in this because, you needed a license of some sort. And so I decided to go to Atlanta. Dr. John Turner is the creator of the system. He's a chiropractor, and he's been doing this for quite some time. And it's a phenomenal program of how he can access brain lobes, access different emotions that are associated with that. So that's how I got where I am today.
Wow.
And I think then you and I met when I was at the end of my training, and then I think I gave you, like a guinea pig. I was seeing people because I felt, well, that was a good training for me. And I think in some ways people went, wow, how did you? And I go, beyond me, but we got somewhere with it,
Yeah.
So that's
Well,
where,
just to recap, so you had this experience and then you were referred to QNRT from someone who
well,
practiced in it? Yeah.
yeah, she was an EMDR therapist, and she was about
Okay.
to retire.
Oh,
And so
EMDR.
she then gave me this woman's name, and that's then how I got hooked up with
Okay.
this whole method.
Great. So
Um,
one short little pause here. I just want to let you know that we dropped off of Facebook. I don't know why. So I'm recording, so we'll
that's
just
okay.
post it
That's
again.
okay.
So just
That's
wanted to let
okay.
you know, but I love it. So you had said to me when we talked at one point, you said everything is stored in the body. Whether we can access it or put it into words, it's not,
Right.
it's there. So can
Right.
you talk about that a little bit, because
Yeah. Well,
you were just, it's kind of like what you were saying, the trauma happens, can layer upon layer.
right.
So, but yeah. So what does that mean?
Well, I think the thing that amazes me is that our cells, muscle cells, every cell has memory. They have memory. And what I've learned through this process, and even doing different people, different clients, is that some of the traumas are so early in life,
Yeah.
they don't remember these traumas because
Right.
you can't. It's impossible. So
Right.
let's say I saw he was a 20-year-old, and I got age 3 on him. Of course, he has no memory of this, but when you're like in utero birth up to you don't even have language. You
Right.
don't have verbal
Right.
skills to say and articulate, oh my gosh, this is what happened to me. And so what happens to that stuff? People say, oh, the kids don't remember. I'm thinking, far from it.
Right.
Everything is stored in your body. Everything. It gets stored in the memory.
Right.
And then somehow, if you can't release it, it goes to different parts of our body. And that can come out in various different ways, whether it be anxiety, whether pain. Sometimes, especially when I was even in the hospital, these patients had pain, always pain. Who knows what kind of pain, but every 4 hours they'd come for their pain meds. And
Wow.
after a while, I would say, let's sit down and talk about some of this. No. Because if you can, it gets stuck. It
Yeah.
gets stuck in that body somewhere, and
Yeah.
the pain is real. I'm not denying that.
Right.
But if you can release whatever is stuck, that pain will go away. Trust
Right.
me. It's amazing. It's
Yeah.
amazing. I mean, I've heard many stories, even from Dr. Turner, about this very same thing.
Yeah.
Of a woman who came in for sciatica pain for years, and he said I couldn't figure out why she couldn't get better. And then when he got this whole program set up, he did one session with her. And this woman, he said, this woman never came back for 6 months. And he said, I thought, what happened? She came back after 6 months. He said, I didn't even recognize her. She looked fabulous. And
Wow.
she said, unbelievable. The one session you did with me unhooked whatever that emotion was, and my pain has been gone since.
Wow.
And so it just goes to show you, we are all integrated into one thing.
Right.
I mean,
Right.
So,
So
you know, it's like your body, there's a good book out there. And I can't,
the
is it
body
Keep,
keeps the score.
Keep Score? Oh my
Yeah.
gosh.
Yeah.
Because
I've heard of it. I haven't read it, but I want to.
I haven't really read all of it, but I've read different ones as well. But your body does keep score.
Mhm.
It just does not let you forget.
Yeah, I feel
Uh,
like I've been dealing with that recently. Like, so I'm sad that you're not practicing right now, but I've been getting massage and chiropractic. But I feel like I've had this, like, yeah, traveling. It's muscle fascia related, and
yes.
just the other night I was looking into that book and came upon just
Okay.
a little summary of, you know,
Yeah.
related to the search on that book.
Yeah.
And there was some other site that deals with brain trauma
Right.
related kind of topics, and it said that it's often muscle fascia related, you know,
It
the
can.
trauma, and as far as the body keeps it, you know, how the
It's,
body keeps trauma. Yeah, so it's just, I've had this guts instinct that that's what's going on with me, and it's getting
yeah.
worked out, but boy, it's weird how that
Yeah, I know.
flares it
Well,
out of nowhere too, kind
I
of, you
know.
know.
I'd love to do QNRT on you.
Yeah.
It does because it really is exciting to be able to help people release. It's kind of like meridian stuff in a way. You know, you how you get a point where it gets stuck.
Hmm.
And if the flow, you need the flow, and so it can go away. But so yes, it's interesting how people don't remember. And you know what? I mean, also learning the QNRT, some of this trauma that we have, I've learned that sometimes it's not even our own trauma. It can
Really.
be generational trauma
Sure.
that is woven into our DNA.
DNA. Yeah, I
And
totally
I've
believe that. Yep.
seen that over and over, that
Mm.
we start to carry the generational traumas,
Right.
like people from war areas. I
Yeah.
mean,
Wow.
it's woven into our DNA. I kid you not,
Wow.
which is to me unbelievable that we can even know that.
Right. Right.
But
So
anyway,
I've obviously had the, you know, therapy with you, but for anybody listening, maybe try to break down, because it is like,
yeah,
you know, what I know what it feels like. I know what it looks like as
yeah,
far as, you know, the
yeah,
therapy, and it's I think it's really nebulous right now so far for what we're talking about.
right,
But just
right.
like how talk about like um how what is the process to
Okay,
unwind
okay,
the
okay.
trauma via the
Yes,
QNRT
yes.
process that you lead someone
Okay.
through? How does that work?
Yes, it is kind of complicated, but not really. And
Mhm.
it's kind of it's different than most therapies. It's unlike anything you've probably ever seen. I mean, EMDR does use the eye movement, but
Mhm.
this one is it's like a muscle testing. So I can use the person's arm and I can test the different brain lobes, and I can tell when there's a lock or an unlock.
Mhm.
And that indicates to me where the body gets stuck. Now, he has broken it down, and I don't want to get into all of it because it's quite intense, but he has broken it down into different parts of the brain lobe
Right.
and where things get stored. So a lot of times when I'm doing therapy on people, cerebellum is at the base back of your head, and that's obviously the first primitive brain that we have as a
Mhm.
child. So a lot of it gets stored here, but as we grow and mature, you know, we get frontal lobe. Frontal lobe is more of the higher functioning part of our
Mhm.
brain. So I usually have people stand together with their feet together and then have them close their eyes. And then there's usually a sway of sorts. And then
Mhm.
when the sway happens, then you go, okay, it's on left side or right side of the brain. That tells you something right there.
Mhm.
So then we proceed into seeing what brain lobe I need to get into. And what I use is the muscle testing that tells me something. I also use a laser, and
Mhm.
the laser itself, I know this is the laser itself sort of like it sort of stimulates the cells in
Mhm.
that area.
Mhm.
And so then that can give you a release of sorts. So I use that to then find what brain lobe I'm in.
Mhm.
Once I get into a brain, and I'm going to say there's 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 different brain lobes that you can get into.
Wow. Wow.
And so once you get into the brain lobe, then we can sort of unfold the story.
Where does the eye come from? Is that helping you get into the brain lobe? Because I know you do that kind of thing.
Well, that is
Is that
so before I even get to the end of the session, at the end of the session is when we do the reset. And the reset involves all of the cranial nerves, you know, the eyes, the smell, the sound, the taste, that. So you do all these weird kind of movements. But before I even get there, we have to get into a brain lobe.
But isn't there like eye dilation to involve something?
Yes. Like when I do some of the tests, I can tell.
That's helping you determine which lobe.
Exactly. Exactly. So for cerebellum, for instance, I think how do I do this again? Cerebellum usually is it's eye movement. You know, and I also use a light to have people move their eye, and then I test with their arm. If it goes off on that side, then I know I'm on whatever side of the brain or this side. So that's one of the tests that you can do. There's also the dilation of the eye. There's also sometimes I use tuning forks as well to sort of give you an indication what lobe you're in. But a lot of it is eye. I use there's red and green glasses, which also gets you into the occipital lobe. Occipital is related to eye. Right. So it's all so connected. It's actually marvelous. This is like I think it's just incredibly brilliant on this guy's part to be able to put all this together. So when I get in, let's just say we get into cerebellum. Cerebellum, in it by itself, is about the emotions of being unbalanced, being unsure, victimized, or unsafe. That's the emotion. But then once I get into cerebellum, then I have to test different parts of the body. Like the pericardium, the lungs, the heart, the pleural cavity, and I do that with the laser. And once if I put a laser, let's say over your heart, and it unlocks, I know then we're in the heart organ, and then the heart itself then has another emotion attached. Heart itself is feeling stabbed in the heart. Duh. I mean, you know what I mean? It's so then that's how you kind of create the story of what the emotion is. So just through testing different parts of, and you know, it gets complicated because like if you get into brainstem, I'm testing everything: the iris, the ears, the tonsils, the lung, the thyroid, the uterus. I mean, you test everything, and every organ has an associated emotional stress to it.
Wow. Yeah.
Okay. So once you get that, then I go into the rest of the story, and I test adrenals because you want to know, because the adrenals are, you know, stress. It's a stress, keeps you kind of regulated. There's short-term stress, long-term stress, and they're in, or exhaustion. And then you can just even tell, like, if you're in exhaustion, if the adrenals are in exhaustion, that's a long-term stress. So that's probably a very early trauma. If it's like alarm, for instance, that's like now in the moment. So that gives you another clue to where we go from there. Then you can test the pituitary with this, whether it's the long-term stress, short-term stress, or sometimes it's confused stress. Now, confused stress, I know this gets so complicated. Sometimes but anyways, confused stress is probably a current stress for the client and another stress of somebody else. So could it be a parent, could be a grandparent, it could be a sibling, it could be anything. So you have two kind of things. So then you go on and you test the nervous system, and then what else? I mean, there's a lot to it. But then what's also interesting about this is that you then can test, for instance, if we're in the cerebellum, there's a way you have the person, you know, swing their hand over one another, just a random, whatever comes up. that indicates what side of the what emotional role the conflict is with.
Okay.
For instance, if it's the father side, father is sort of the dominant. I know it's kind of a traditional thing, but the father is sort of a traditional role. So that can tell us, is it about the father? Is it about a spouse? Is it about grandpa? Bosses? I mean, the roles are very, which I don't really, but I think we just have to go with this. But
Sure.
And then if you do it the other way, then you're on the mother side. And so so that tells you all about that. So from all of that testing, we have now come up with, how do I want to say this? We've come up with a little story.
Right.
Like, how do I want to put this? Because, for instance, wait a minute, let me get, I had somebody's out. I was just going to give you an example of how we kind of do this.
Sure.
Wherever I put it. Hang on. Sorry. Okay, for instance, here. For instance, now it's raining here. For instance, the last one I did, I was in the cerebellum imbalance, and cerebellum is about unbalanced, unsure, unsafe. So then there's a statement that he has created so you can formulate the story. You have to pull all these pieces together to kind of formulate a story of the feelings, what age you were, what side of the family, what role. And this poor child, he really has no memory of his early childhood, which that in itself gives you some indication of what's going on with him. Yeah. But it didn't matter. I said, if you don't remember, you don't remember. I don't need you to remember because your body's telling me.
Right. Yeah, that's what I find so fascinating.
Yeah, and I find that that's the most fascinating piece for me is that he really didn't remember. But I would then, because it was a story, it was about shame for him. It was about unworthiness. He felt unreal. And so anyways, I got the whole story. And then once I get the story, then I test the cranial nerves to see which ones we need to activate.
Okay.
And activating the cranial nerves is a way to do the reset for the trauma. Does that make sense? I know it makes sense to you because you've done it.
Yeah, I've been, yeah. So it's like, yeah, so basically, let me just try to recap and see, just to encapsulate it. No, so at the beginning, you're doing a variety of tests to find out what part of the brain the trauma is stored in, right? Is it stored in the brain or is it in the muscle and tissue? That's where I'm just getting, or you're accessing the storage of it through that lobe of the brain?
That's a good way of putting it. You're accessing it through that brain lobe because it's all memory.
Connected. There's that connection to that brain lobe.
That brain lobe.
That particular.
Right. And that, let's say this brain lobe gets connected then to an organ.
Okay, right. So I know, and it might help too, because in my first few experiences in sessions with you, unbeknownst to you, I had, it came up, the organ it was my thyroid.
Yes.
And
yes.
Gee, I've been diagnosed with Hashimoto's thyroiditis in 2012 and was hypothyroid even before that. So, it just blew me away that that's the organ. And then, so also too, I want to make clear that when you're doing this testing, like what you're talking about, the story that's being crafted, you're, at some point you're at the very beginning, there's a core belief that's expressed by, is it the organ that you determine? Like, so it goes to thyroid and the core belief, but there's that before, I forget, because there's like the core belief.
Well, even here's the other thing that I don't want to get into too much detail because I don't know, but if I can't, let's say I can't get into a brain lobe. And sometimes that happens. The body just is like, can't get there. So then I have to do some other tests prior. So that's because it's like opening doors to your brain.
Right.
Then there's a core driver, and the core drivers sometimes are really early kinds of things. And so if I can get into a core driver and then resolve that, then that allows me to get into the brain lobe.
Okay. Yeah, I see what you're saying.
And and I mean, there are different things, like core drivers those are such really ingrained beliefs from early on.
Right.
And
yeah, like unworthiness or that kind of thing. Mm-hmm.
Yeah, you get stuck there. I mean, you get stuck there. So I can then I can reset the core driver, and then I go back to start the testing all over, and it's amazing that then I can get into a brain lobe.
Okay.
And I don't know, the body will tell you, no, I can't open the doors right now. I'm not going to let you in. And so just by doing these other tests prior to getting into brain lobes, but it's still all connected, because the core driver also tells you about emotions.
Right.
Right.
So basically you're testing to see what lobe of the brain is connected to the trauma that's being stored in the body somewhere, usually associated with some organ. It's always is, because it's the tissue in your body storing it. So for me, in my case, I had multiple times where it came up the thyroid. I know at one point there was something connected to the knee, which interestingly, I've had knee issues too.
Yes.
I know. Yeah, it's crazy. Then you're doing this testing. It's a lot of muscle testing. So like, trying, determining if something, I know sometimes you'll have me do la, 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 and then and test again. And that determines.
Well, so that's, so the once we create the story and we already figured out some of the emotions and what parts of the body it's being stored, then QNRT does a hypothalamus reset. And the reset is where you then can release those stored emotions.
Okay.
So that's at the end. After we've crafted and got the story and blah, 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 then I test the different parts of the brain to see where we are with that. Okay. And then that's when I do the weird stuff, like tapping on your head, because that activates the cranial nerves. I also use the eye movement, like back and forth eye, because just by moving your eye up gives you a different part of the brain lobe. I also use oils for the olfactory, that stimulates that part of the cranial nerve. La la la, that does the cranial nerve. I don't know which one it exactly is. I think it's the vagal nerve. So we test the olfactory, optic, trigeminal, facial, vagal nerve.
I know I do a shrug sometimes.
Then you do a shrug thing. That's the trapezoid muscle ones that activate. So and then I do all of this at the same. And sometimes I also use like the tuning fork.
Tuning fork, yeah.
Yeah. So then I do a set of that and tap on your head, and you're doing all these weird contortions. And then I retest to see if we have to do it again and again. I can tell when the brain took it in and said, good, we're good now. I've locked it up. We're good. I've released that. And then you're finished.
Wow.
And then what I like to do is then, test people with the little story that we created for you that has to do with whatever particular thing it is. And sometimes they're minor. And minor traumas, because you have to almost peel away to get to some of the deeper traumas. But anyway, so that's sort of complicated, but
it's hard to follow if you haven't been there with it and understand. But basically I can express, and literally, like, how long does an appointment with you last? It's like 45 minutes.
Well, you and I 2 hours.
Because we talk.
Because we talk for 2 hours.
Exactly.
But it usually it can take anywhere from 30 to an hour. It depends. Like with this young man, young man I did, he really wasn't very verbal, and he didn't really want to share, and that's okay with me too. That's totally fine.
Right.
Just by doing the reset. In fact, I've done him twice now in the last couple of weeks, and the first time I saw him, I swear, he was constricted. I could just tell his
Mm.
affect was just. And this last time I saw him, I went, wow, I could just tell, and he was a little bit more animated, and I
Yeah.
went, I mean, it just blows my mind.
Wow.
So, and
I know
he,
when I came to you after 3 times, I think total, I remember you asking me like, how are you feeling? Is there
yeah,
anything that you're feeling different? And I said, I don't know how to describe it other than
yeah,
I just feel lighter on the
yeah,
inside. And then you said, oh my gosh, that's exactly what these 2 other women had said. So it's so funny how
yeah,
it's like clearing
yeah,
something out that
yeah,
you don't
yeah.
know is there, but when it's
Yeah.
gone, you notice that it's gone.
Yeah,
It's really,
exactly. And
yeah,
it's like and it's subtle in a way. It's
right.
subtle. Like, okay, maybe I slept better or I
Mhm.
didn't have so much anxiety. And
Anxiety,
most
yeah.
people say, I don't know, I just feel a little lighter, like something's been lifted. And
Hmm.
it has.
Yeah,
We've
yeah,
lifted that piece out of
right,
your body for the next one to appear,
right,
I
right,
guess,
right.
but that's how people describe it. It's like,
Mhm.
and and I've done people too with pain, and usually there's a pain protocol too. I think that you can do the pain piece first and then get into the brain lobes.
Mhm.
And then I did this other woman, and she's by the end of the session she goes, that's really funny that my it doesn't hurt anymore. I go,
Wow.
I'm amazed myself, trust me.
Yeah, I
It
would
always
imagine.
gives
Yeah.
me goosebumps, like, because I always feel like, do I know what I'm doing? But it is so powerful. It's
Yeah.
powerful stuff.
I just am so fascinated by that connection with the brain and the body. Yeah, it's amazing.
We're all one, trust me.
Yeah.
It's
Yeah.
all, we just don't forget, trust me.
Yeah.
So
So
that's the
I
story.
wanted to ask too, as far as I know you kind of alluded to this already, but you were drawn to it based on what obviously was an intense trauma. But what you just recently said is it doesn't even have to be such a big trauma and our body stores it. And I would say for me personally, that has to be a lot of it's been emotional trauma, personally, because I haven't had any assault. I haven't had any
No,
kind of, I've had accidents, like
yeah,
car accidents and things like that, that
yeah,
obviously are somewhat traumatic in the process, but they weren't, the one that
right,
was the worst was I was completely asleep for it. So I didn't even
right,
know. So I couldn't be traumatized by it necessarily consciously.
right.
But I also, certain personalities perceive certain things in ways that are very traumatic to them that other people, it rolls off their back. And I'm that type of person. So that's how
Well,
I think a lot of it's developed for me.
and the
Yeah.
other thing is even in your early years, I mean, little
Mhm.
children,
Right.
I mean, little children take on, if, for instance, if your parents are fighting in the other room,
Mhm.
has nothing to do with the child, but that child takes it inward, and it takes it
Right.
in a way that they go, I must be bad,
Right.
because they can't articulate,
Right.
they don't know the difference. So first of all, you get that, and I mean, that is that a big trauma? Probably not, but to a little kid, it is a
Mhm.
trauma.
Mhm.
It's like, because then it sets up your brain in a way.
Mhm.
Does that
Yeah.
make sense?
Yeah. Yeah.
And they can't articulate it. So in little children, they always interpret it as there's something wrong with me.
Right.
I did
Right.
something bad. I'm not
Right.
good enough. Otherwise,
Mhm.
if I was good enough, my parents wouldn't be fighting.
Mhm.
So it gets woven into, and we all do the best we can. Trust me. I'm not
No.
I'm
No.
not judging any of this, because
Sure.
we just do the best we can, and you don't even know little kids take things in. Some kids would, some kids will say,
Mhm.
doesn't bother me. So
Mhm.
so
Have
yeah.
you seen it? I don't know if you've had patients with it, but what can you distinguish between? Because I know it's a term that is much, much more common nowadays to refer to PTSD, post-traumatic stress syndrome. I mean, or disorder, PTSD. I mean, how is PTSD different than just trauma? Or
Well,
are they the same?
I don't know that it is.
Is no.
I don't know that it is. I mean, I think PTSD, because little trauma, big trauma,
Hmm.
trauma's trauma. I don't know that it makes a difference if, I mean, I think bigger traumas can impact you far greater.
Hmm.
But to me, a trauma is a trauma.
Hmm.
And so I can't measure that trauma was worse than this trauma. It's how you interpret and how the brain filters it into your being.
Right.
So trauma's trauma,
Yeah. Yeah.
big, little, it doesn't
Yeah.
matter.
Yeah. Hmm.
I don't think so.
So, what kinds of results are you seeing?
Well,
We talked a little bit about that, but like you saw the lightness in his
yes,
face and his
yes.
countenance, and that was what, after 2 sessions
Yeah,
or
that was
so?
after 2 sessions.
Wow.
Can you
Wow.
imagine? No. I think that for me, I think trauma, the interesting thing about trauma is that if you can't or don't resolve this trauma, our traumas dictate our decision making in life. Does that make
Hmm.
sense?
Oh yeah.
So I think by releasing some of this, you become more clear of who you are and what you really want.
Hmm.
Because, like I said, our bodies want homeostasis. And if you don't resolve the trauma, it will repeat
Mm.
in a different fashion, different
Mm.
way, but it repeats. And
Right.
so that that does is it reinforces that trauma instead of resolving it. Because I think our purpose is to repeat it so we get a different outcome.
Mm.
And it doesn't happen, trust
Yeah.
me, until you really release it. You don't get the different outcome. And so, I mean, abuse, for instance, I think people who have abuse in their background, whether whoever is, doesn't matter who the abuser is like they're sort of like drawn to people that will reinforce
Mm.
and give them that abuse. Does that
Right.
make sense? And
Yeah,
it's like,
right,
that's
totally.
not, they don't want that, trust me,
No,
that's
but
not
it's
what.
like hardwired kind of in.
Exactly. It's
Yeah.
hardwired. And so then they're thinking, I'll be with this person. That person will make it different for me than, let's say, it was my dad. And so, but guess what happens? It's almost a repeat of the dad.
Oh,
Does that, so
yeah.
people, I think, feel better. They feel clearer. I think that they can make better decision making in their life. I think they
Hmm.
feel more present.
Hmm.
I think anxiety, depression, sleep, eating. Some people, there was a woman I was doing a starving for love. I'm thinking, you got an eating disorder. I mean, you know what I'm saying? That was connected for real. Starving for love.
Mm.
That's what the emotion is, about.
Oh,
So you're just more clear. You're more
yeah.
present. You're more like able to make better decisions for your life,
Yeah.
for your relationships, for your job, your
Hmm.
career. I mean, because we
Yeah,
all reenact stuff, I think.
totally. Well, I can totally attest to that. I mean, for me, I think when I met you, um,
Yeah.
yeah, I forget now, like time is just
Yeah,
like
I can't
mush.
either. I don't.
But I know it was like, me, I know on one level I was dealing with the grieving of my
Right.
mother and then her passing, and then I forget when we met. So it's hard for me, but
Yeah.
then my dad did too. But yeah, I just know that like even when I first sought out the therapist who had the brain spotting therapy, which she did do on me
Right.
as well, and that was really helpful. And then yours in combination with
Yeah.
that was really just
Yeah.
amazing. And it moved me out of my description of it is I just felt stuck.
Yeah.
Like I
And
couldn't
that's it.
and
And
I
that's
couldn't move forward with what I wanted to do.
yeah.
And it's because
Yeah.
like what you were
Yes.
just saying, the brain processing and the decision making, I just was stuck in
Yeah.
inability to make a decision, like a
Yeah.
positive move
Yes.
in my life, yeah. So
Yes. And I
a
think
lot
that,
of, yeah, and I felt different, and definitely after one, but I would say for sure after those first
yeah.
three, it was like
Yeah. Yeah.
big
Yeah.
time, yeah, movement. And then I've had maybe 3 or 4 more with you,
Yeah.
I think, and each time it just feels like something loosens up. It's just
I
like it's
know.
not like right in
Yeah.
front of my face
It's
instantly, like I
it's
see this difference, but it's just, yeah, like you're saying,
it's
decisions
a
feeling
very it's
lighter.
yeah, it's a very
Mhm.
subtle kind of feeling. Like,
Right,
it's hard to describe, but there's a subtlety about it.
right.
And honestly, from the very beginning when I met you, you've come a long ways.
Oh
And
yeah,
I mean that. I really look at you because
yeah.
you're able to put yourself out there in a way I don't think you could
No,
before.
no,
You know
no,
what
no.
I mean? So
Yeah,
it's almost like you to me, self-confidence, self-esteem,
yeah.
all these
Hmm.
things
Hmm.
sort of like are there with you right now. I mean that. I
Yeah,
From the
yeah.
very beginning to now, I think you've come a long ways. I mean that.
Yeah, no, I believe it. And I know it's been integral in that. I mean, I've been doing, I've just been seeking that freedom from all that stuff that has been weighing me down. And I know QNRT really played a huge part in helping release all that. Yeah.
Yeah.
So if someone's out there, listening to this and has questions or just is wondering anything more about, like, I don't know, what would you say to someone who feels like I'm stuck, or I just can't,
Yeah.
move forward, or they know very blatantly they've had a trauma in their life and they're like, I don't feel it's resolved. What would you like to say to that person?
Well, I think that they could try a session, and here's and the beauty of the QNRT is if you don't feel like you want to talk about it, not necessary. This process can access something so far quicker than any kind of talk therapy. You could do talk therapy for 10 years and still not get to the real
Right,
root.
right,
And I'm not dismissing talk therapy. I'm
right.
just saying, like, how did I get this kid a couple weeks ago? And I go, age 3,
Mm,
and he didn't even know it.
mm.
So to try it would be, I think it's just well worth it just to try it. You don't
Yeah.
have to continue. You don't even have to talk. You can let me do all the talking and let me do all my little weird stuff and go home and see how you feel.
Yeah.
I
I
mean,
mean, and it's so uninvasive, and the most
yeah, it's not.
invasion it is that she tests, like,
Yeah,
trying to get this in the camera,
yeah,
like muscle tests
right,
like this, and
right.
maybe touches the head a
Yeah,
little bit and does this with the light. That's
yes.
like, it's so uninvasive. Yeah.
Yeah, it's just it's a non-invasive kind of
Mhm.
technique that you don't, and for people that are really defensive, because they have to keep they have to keep all of this stuff intact. It's a good way to sort of access it without having to really letting all of it disappear in front of you, because that's
Right.
too scary for people. And
Sure.
you shouldn't let people, all their defenses go away. You should never do that, because it leaves them too vulnerable.
Right.
This is subtle, this is easy,
Yeah.
it's gentle, and
And it's
it's
really your body telling the story too. You don't really,
exactly
that's what's so fascinating about it. And the body just
that's
gives you the clues and you make the story, you're connecting things based on your training, knowing what means
mhm.
what leads to
and,
what,
and then even for
correlations.
yourself, I
Mhm.
mean, you then started to connect some of the dots too
Mhm.
for your life,
Right.
and that's what I think it allows people to do, like, oh, I would never have thought about that
Mhm.
being something that I was in my way, or I never thought it was like about my brother or my sister, or I never
Mhm.
thought of it like that. So it
Mhm.
helps you expand and become maybe a little bit more insightful to what your life has been about.
Sure. Yeah.
So
Awesome. Well, thank you so much. And we will be, like, I'm sorry for whoever was trying to watch us live,
yeah,
but
that's
this
okay.
has been I have recorded it, and so I will post this, and we'll just, if
Yeah,
anybody
and
has any questions, yeah, reach out. I'll tag Nancy on this so that she can
yeah,
be, reachable
and
too.
I do have I have a Facebook page called insightfulhealth.com.
Okay.
And so people can access that, and that I also kind of give a little bit more of a description of what the technique is about, or they can message me on Facebook, or there is an insightfulhealth.com webpage as well.
Okay. Yeah. So I can put those links in this when
Yeah.
I post the recording of this. Great.
Yeah, yeah,
Awesome.
no,
Yeah.
absolutely. And feel free, to reach out to Wendy, and
Yeah,
Wendy
I've
can,
been there and done it, so I know, and
and
it's been,
it's safe, and it's just non-threatening, and that's
yeah,
what I
and
like
yeah,
about it.
yeah,
Yeah.
yeah.
Okay.
It's really like, and it's not that expensive overall from my
No, it's
standpoint of a
really not.
therapy. No, mm-mm.
No,
So
not really.
cost isn't really big, but yes, thank you for spending your Saturday with me.
Thank
Thank
you.
you.
No, I
Yeah,
appreciate it. Thank you so much, Wendy. It's been fun.
great. All right, you have a great
Okay.
weekend. Bye
Yeah,
bye.
you too. Okay. Bye.